Okay, so hi, my name is Henry, and I have been an intern at PACH for about 6 weeks now. And my project has been specifically working with the Healthcare Access Survey. And so the title of the survey is Evaluating Access, Affordability, and Availability of Healthcare Services in Ecuador, a focus on five key medical specialties. So first, I wanted to talk a little bit about me and who I am. So my name's Henry. I'm a pre-med student at Princeton. I'm a rising sophomore, and I'm a potential medical anthropology major, but I'm not sure right now. And I love swimming, hiking, and going to junk stores. And during this internship, I've been the lead researcher in the Healthcare Access Survey, which basically means I've been conducting various surveys with the patients in our caravans and asking them about their access to healthcare. And also, I've been organizing the data and I'm put it together to give Patch and FuboSpam some recommendations for future caravans and identify some healthcare access barriers. And I've also been collecting data for the observational surveys in which during our caravans, I would go outside and kind of observe the stuff that was going on and put some data in just about the general locations of our caravans. And then also, I've been shadowing doctors and helping out with caravans by doing the vitals for patients. And also on the side, I've been traveling a lot. So here's some pictures of that. Okay, so I'm going to dive a little bit into what the survey is about. So, the purpose of this research is to uncover and document the barriers that prevent people in Ecuador from accessing healthcare. So, specifically, we've been studying across five critical medical specialties that are ophthalmology, general surgery, gynecology, mental health, and nephrology. And these areas are chosen because they're specifically very hard for rural populations to access because there's very few doctors that have these skill sets that are easily accessible in these areas. And this study looks at a couple of different types of healthcare barriers, such as different healthcare levels and efficiency. So that's like how well public and private systems function and how quickly patients can be seen. And then also pricing, in which some people can afford private care, or also even low-cost care can still be hard whenever traveling is factored in. And then there's also geography barriers, such as like mountainous areas, especially for indigenous populations. And then there's also stigma, which is also especially in indigenous populations, in which cultural perceptions and fears of doctors can often discourage people from coming to seek care. So we studied four different provinces in this survey. And firstly, Chimborazo, which is the home base of Patch and Pibespam, which is an Andean province. And then there's also Morona Santiago, which is a geographically isolated Amazonian province, which is right over here. And then Loja, which is a southern Andean province with Loja City as the capital. And there's a little bit more of a dispersed rural population around Loja. And then finally, Tongahora, which is a central highland province. All right, so some of the methodology with our study. So our study, we used a mixed methods approach to better understand the healthcare access. So we combined patient surveys, observational fieldwork, national census data to create a more complete picture. And the healthcare access survey was conducted with the patients in our medical caravan. So we asked the surveys during like the waiting time for the caravans. And each participant was asked various questions about their access to specialists, their knowledge of treatments, the costs, and the general perceptions of healthcare. And each participant was given a clear, informed consent paper and was also adjusted for literacy levels. So if patients couldn't read for some reason, then the surveyor would read them the consent form so they were aware of everything that they were getting into with the survey. And then after that survey data was collected, we compared that to the INEC 2024 national census data about healthcare in Ecuador. And like I said before, we focused on four different provinces in the Andean and Amazonian regions. And we surveyed in 12 different cities and towns, ranging from very remote Amazonian settlements to larger Andean cities like Loja. And our approach brought together the patient surveys, the observational field notes, and the census data, and cross-referenced all of these so we could identify some very specific gaps with healthcare in these areas and also provide very specific recommendations for Patch and Phoebuspan to implement their resources in the most efficient way. And the study did receive IRB approval from the University of Vermont, and all participants were given a consent form and no identifying information was collected. All right, so first I'm going to go over some of our quantitative findings from our national census data and our observational surveys. Or not our observational surveys, from our survey data, the healthcare access. All right, so the first thing that I looked at was the hospital usage versus the number of available hospital beds. So the graph on the left depicts hopefully this is big enough for you guys to see, but the graph on the left depicts the um, number of hospital discharges per 1,000 inhabitants in a province. And then the graph on the right depicts the number of hospital beds per 1,000 inhabitants in a province. So comparing these graphs basically means comparing the hospital usage on the left to the hospital capacity on the right. So some of the key takeaways from this were first, if we look at Chimborazo just as kind of like the baseline for Passion Fever Swim, 69.9 discharges were done in 2024 per 1,000 people, and 1.42 beds were available per 1,000 people. So that's kind of like a mid-range number. And then if we look into some other provinces, so you can see here in the orangish red, Morona Santiago was one of the provinces that we investigated in our caravans, and it has a little bit of a higher discharge rate than Chimborazo. So it's 79.52 discharges per 1,000 people. And there's only 1.32 beds per 1,000 people, which means a higher discharge rate and a lower capacity, which is usually an indicator that hospitals are overused and people need more care and they're not able to get it. And another thing that I wanted to highlight with these graphs is the region of Zamora Chinchipe down here. While we didn't actually conduct healthcare access surveys here, we do still have census data from it. And it's very isolated from Chimborazo in the main government, which often leads to more healthcare neglect. And Zamora Chinchipe has the highest discharges per 1,000 people, 93.93, and a very low availability, which is 1.19 beds per 1,000 people. So this really quite drastic gap is something that I think is important to point out because even though it may not be the most efficient place for passion fruit swim to do caravans because of its distance and also its isolation, it's definitely something that needs to be further investigated. Okay, so now I'm going to go into a little bit of the findings from our specific specialties. So this top section over here, this is data taken from the national census. And this is just the number of institutions or the percent of institutions and the number of institutions with availability with gynecology. And then the bottom here is directly taken from the survey that was conducted, in which people were asked if they had or if they were offered these specific like procedures within the gynecology specialty or if they have access to gynecology as a whole. And these are the percentages of people that said no. So some important things to point out. In Chimborazo and Loja, about half of the health establishments have gynecology. And most people are aware of their access, though. As you can see here, Chimborazo, about 80% said yes. And then in Loja, about 95% said yes. But something that's interesting is in Morona, Santiago, 89% of the health establishments contain gynecology. You can see that here. And most people, when they were asked if they have access to gynecology, they said, yes, we do. But whenever they were asked about more specific procedures in gynecology, such as cervical cancer screening or uterine prolapse, a lot of people said that they did not have access to it, along with a lot of other procedures in gynecology. So this could indicate a need for health education on exactly what these procedures are, because people are saying, yes, we do have access to gynecology in general, but whenever they were asked specifically, it seems like more people were like, wait, where they weren't sure if they knew what it was or they weren't sure if they had access to it. And also, I am keeping Zamora Chinchipe down here, even though we didn't have any data to compare it to with the surveys, just to highlight that there are very few hospitals here, and they provide very basic care. Although they do say that they have three with gynecology access here. All right, so now we're going on to a quick general surgery. In Chimborazo and Loja, less than half of the health facilities offer general surgery. And one of the main things that I wanted to point out with this section is that in Morona, Santiago, there are a decent amount of locations with general surgery, 6 out of 9. But the larger proportion of people claim that there's no general surgery in their town, about 56% of people. So I think that that definitely shows the need for a little bit more education on exactly what people have access to and maybe how they can have access to it. And once we move on to nephrology, in Chimborazo and Loja, there's barely any nephrology services offered. You can see that kind of the numbers drop down when we get to nephrology. Only one out of the total institutions in Chimborazo, Loja, and Tungurahua. And in Chimborazo, 43% of people said there are no services in their area, which kind of makes sense because there are very few. But in Loja, only 11% said that there are no services, which is an interesting gap because there's only one in the entire province. And then finally, in Morona, Santiago, there's no access to nephrology, but a decent amount of people claim that they do have access, like 62% of people, which I think was interesting, which could also show an indication that education about what exactly nephrology is necessary because if that many people are saying that they have access to this, it's interesting considering there is no access according to the national census. All right, and with ophthalmology, it's pretty basically similar to nephrology. Like all of the highlighted provinces, there's very low to no access to ophthalmology. Um, it's also important to note, though, that in Loja, 100% of people claim that they have access to ophthalmology, even though there's only one center, which is generally a good thing because they seemed it must be very easy to get to, so that must be a good indicator. But however, in Tungahora and Mona Santiago, there are few to no ophthalmology centers, and most people also claim there are no ophthalmology centers. So this is a clear indicator that people do not have access to this, and they know that they don't have access to it. And then finally, with mental health services, similarly to ophthalmology and nephrology, the highlighted provinces contain very little to no access to this. And there's also an interesting difference between the survey and the census, because in Loja, Chimborazo, and Tungahora, people say that they have access to mental health services, except the census says that there's no more than one facility in any of these provinces. So I think that this is definitely a very interesting case because it seems that people are claiming that they have access to these things whenever they aren't necessarily sure exactly what these things are, or if like they're being provided the care that is being described in the survey. So I think that's definitely was some confusion with some of those questions, and also like the language barrier was also it made it harder to kind of distinguish between that. Okay, so now we're going to move on a little bit to more talking about public versus private institutions. So these two maps here on the left, this is the percentage of public institutions in each province, and then on the right is the percentage of private institutions per profit in each province. And there's really only one really important thing that I want to point out here is that Morona Santiago over here and Zamora and Chippy over here both have very high percentage of public institutions. And because of a lot of the people that we've talked to in the caravans and just general knowledge about public institutions, typically, when there's a majority of public institutions, people tend to have a lot longer wait times and very, very basic levels of care. So this is definitely an indicator that these areas specifically struggle with that, and I think that's an important statistic to point out. So now some more key findings about indigenous populations. So note that in all of the specialties that I was mentioning before, more than 50% of people said that specific specialist doctors did not speak Quechua. And that was the bare minimum. As sometimes 100% of people said they didn't speak Quechua. So out of the total hospital discharges in the entire country as well, only 3.6% were indigenous, while the entire population of Ecuador is 7.7% indigenous. And this statistic lines up with some other provinces specifically, such as Chimborazo. 14.5% of hospital discharges were indigenous, and roughly 38% of the population is indigenous. So that's a pretty large gap. And also in Zamora and Chippy, very similarly, 6% were indigenous, and then also 14% of the entire population is indigenous. So it seems to be a common theme that about half. But something really interesting to point out is in Morona, Santiago, 42.7% of hospital discharges were indigenous. But roughly 48.4% of Morona Santiago is indigenous. So this could be a good indicator that indigenous populations actually are engaging in the hospitals in this province. So this could be a good indicator for caravans because people will be more likely to go to these caravans if they already have experience with hospitals. All right, and this is another additional finding that I thought was interesting that I may like pose a question out to. Oh, sorry about this. Thank you. Um, In Ecuador, 61.32% of hospital discharges are women, and 38.68% are men. So this is a quite large gap. And I started doing some additional research just to kind of look around. In other South American countries, such as Peru and Argentina, they're very similar stats. So I was kind of like wondering why this could be, and maybe it could be because of stigma or because of the need to monitor women after they give birth. But I actually do address this a little bit later on in the presentation about kind of some ideas about what we could do about this. But it is interesting that there's similar patterns in a lot of other South American countries. Okay, so now we're on to some of the qualitative findings. So at the end of each of our surveys, we asked this specific question. What do you think could be done to improve the healthcare in your city? And there was a large variety of responses, but some of the majority of the people said that they needed more specialists. And other people said they needed less wait time in public institutions because the wait time between public and private was very large. And also, a smaller but prominent amount of people said that doctors needed to be more compassionate and friendly to create a more approachable environment. And another special note was that a lot of the towns could not communicate their access to these barriers because, especially in the Chimborazo province, because a lot of them spoke Quechua, and our surveyors did not speak Quechua, so it was very hard to convey that information, so we weren't able to do it. But I think that definitely skewed the results because a lot of those provinces do experience very extreme barriers. So I think that in the future, if we conduct more of these, it would be helpful to have someone that speaks Quechua to really like kind of cover all of the areas to understand the full picture. And some additional anecdotes just from people that we were talking to in the caravans or people that we had talked to just around Ecuador in our traveling. Um, One woman said that no one speaks Quechua because indigenous people do not want to teach to non-indigenous people because they see it as disrespectful to their culture. And another person claimed that hospitals do treat indigenous people, but the indigenous people refuse to come because they're scared or they do not like hospitals in general. And also, one of the common themes during our surveys that a lot of people were unfamiliar with the terms that were used, such as hysterectomia, because people claim that in Ecuador they call it legado. And also, there was other ideas such as primary, tertiary, and secondary care or mixed institutions that people did not understand. So this could have led to some skewed data or some misinterpretations during the surveys. And then finally, something very interesting that I found was the interns went on a separate trip to the Galapagos over one of the weekends. And when we were there, we had multiple tour guides, and I decided to interview some of them about the healthcare. And a multiple tour guides said that the new president had taken away a lot of healthcare funding for the Galapagos, and that a lot of institutions in the Galapagos, since there's only two public hospitals, they had very minimal care. The wait times were enormous, and people were not getting the care that they needed. And they also said that they couldn't even move more specialists to the Galapagos because of environmental reasons. There is a population cap, and people aren't allowed to move there, so specialists were not allowed to move there. So I thought that was very interesting in that definitely, I was there for a very short period of time, so I couldn't collect a lot of data, but I think that it's definitely something very interesting that we should investigate more. All right, so let me just point out some of the trends in the comparative analysis between the quantitative and qualitative data. So first off, in Morona Santiago and Zamora Chinchipe, the quantitative data and the qualitative data generally matched up in the sense that there's a high overusage in hospitals and a very low capacity and a low amount of specialists, and especially in nephrology, ophthalmology, and mental health services. And this is seen in people in their complaints that we've seen in Morona Santiago. People are saying that the hospitals are overrun, there's not enough specialties, all of the things that we've seen in the data. But in Loja and Tongahora especially, it's interesting because the census shows that there's not much access to certain specialties, especially these three specialties right here. But people have claimed that they do have access to a lot of these specialties in the surveys. So I think that that's a very important educational gap that has been presented. And I think that that could definitely be addressed later in caravans in those locations through educational materials that I'll go over in a little bit. But and also in the Galapagos, I think it's very interesting, an interesting contradiction in which in the maps, the Galapagos seems for its population to have general high hospital availability. And but according to these anecdotes that I've seen, it seems that people are very unhappy with the hospital situation in the Galapagos. So I think that that definitely requires more investigation as well. And a couple of other connections. Indigenous populations, less than 50% of indigenous people are shown to be in hospital discharges as opposed to the whole proportion of indigenous people in the country. And the anecdotes that we've heard, such as the stigma, the language barriers, the limited hospital use, this is all lining up with the national statistics. And then finally, the long wait times that were reported in places such as Morona Santiago also match up with the heavy reliance on public hospitals shown in the census data. All right, so I have a couple of recommendations for interventions for patch and phoebus and places that I think would be the best use of their resources. Firstly, just some general barriers that I've identified across is first, there's huge barriers with specialty access and education. Many provinces have few to no specialties, and especially the perceptions about those specialties often do not match the reality. People are claiming that they have access to things when they really don't, and there's a lot of mixed up opinions within the data so that I think would very much benefit from some intervention with education and also just more access to these specialties. And also, there's a clear strain in the public system, and the indigenous access barriers that we've identified are very much prominent, and especially in places such as Zamora Chinchipe and in Chimborazo. All right, so the first place that I suggest that we intervene in is Morona Santiago for a couple of reasons. First off, if you look at the map over here, it borders Chimborazo, which is very good because it's easy transportation from Patch and Phoebus spam, and also it's still, while bordering Chimborazo, it's still geographically isolated because it's a very large province in the Amazonian region, and people are in this area are very much neglected from the general governmental healthcare system. And also, there's no access, especially to ophthalmology, nephrology, and mental health services. And also, there's a clear need for education because of the discrepancy in the surveys and the census. And I also think it's very important to point out that this place may have a higher turnout for indigenous populations because of the already high proportion of indigenous people that use the hospitals. So in Morona, Santiago, I suggest that we send medical caravans with ophthalmology, nephrology, and mental health service specialties. And I also suggest that we provide educational pamphlets and videos similar to this year, since we've been doing the cervical cancer screening video in our caravans. And I also think that this was a great opportunity to treat large amounts of indigenous people. And I understand that addressing mental health services is difficult because there's stigma and also it's hard to carry out in a caravan. So I suggest that we implement more educational materials, such as a new video or pamphlets or things like that that people could take home that talk about healthy relationships, abuse, and what mental health services are, because mental health services was the number one specialty in which people had discrepancy on what they answered and what they had access to, and also whenever they were asked about specific specialties within mental health. And another place that I think is worth mentioning is the Zamora Tipi, because this geographic isolation here is very intense, but I think that the need for specialties is very clear, ophthalmology, nephrology, and mental health services. And I also think that because of this isolation, people are going to need it much more than a lot of other provinces. And also, I think it's very important that we conduct a healthcare access survey in this location because we don't really have any data to compare to what people know about what they have access to and what they actually have access to. And also, I think additional advertisement is very much needed, kind of what we've been doing this year, where David would go in and talk to a community and kind of establish that relationship. I think that this is very much needed in this location because of the low proportion of indigenous populations that already use hospitals. But yes, I think this would be a very interesting location to consider and maybe start building a relationship with, maybe before entering into the caravan phase. And then finally, with the Galapagos Islands, I think that I understand the barriers for us as far as funding goes because it's a very expensive travel and also the isolation is very intense because it's an island. Um, but I think that it's very important that we do some more investigation. So I think conducting phone interviews and surveys about healthcare access would very much be helpful in learning more information about the Galapagos because just the small amount of anecdotal data that we've obtained has been very interesting and very contradictory to what we've seen in the national census data. So I think the first steps for the Galapagos right now is more just like getting more information before we can really come up with a solid plan. And then this is a kind of side thing that I would like to propose about a new survey is based on the data that we've seen about the higher proportion of women and lower proportion of men in these hospital discharges. I think that conducting a survey to explore this more in the new caravan locations that we go to would be very interesting because um, I think that there's a lot of different opinions about why this is going on. And I also think that it's a very soft subject to talk about because if this is due to stigma, which is very likely that it is, um, then people will not necessarily want to mention exactly why this is going on. So I think that's important that we conduct surveys in a very neutral way, talking about major work priorities or maybe home responsibilities, and then maybe try to conduct surveys with a variety of people, with people of different sexes, people of different ages, and then maybe kind of categorize these people into different sections and then see if there's any clear barriers for each section or patterns. And I think that that would really help us kind of answer this question and maybe come up with a better plan on how to fix that gap because clearly there is a large disparity in in Ecuador and other countries. All right, so final implications for this project. I think that it introduces a very unique perspective in the scholarly community because we have this very unique comparison going on with a lot of different types of data. And I know that Colin's already gone over a lot of the observational stuff, but that adds a whole new layer to what we're talking about. And I think that the idea of comparing census data to real life anecdotes and also survey data, I think it adds like a very multifaceted perspective that really allows Phoebus and Patch to zero in on places that need their care the most. And also, I think it's very scalable to other countries, especially in Latin America, because based on just some of the side research that I've been doing, there's a lot of very similar healthcare access barriers in places like Peru or Chile or something like that. There's a lot of data that could be collected in those areas using these methods, and these results could also be applied to other organizations in those areas that could really hone in on those problems and try to overcome those healthcare access barriers. And honestly, at the end, I think that it really highlights the importance of getting all these different perspectives, such as specialist care education and gaining community trust. And it just shows that healthcare intervention is a lot more complicated than people often think. And I think that all these provinces has very specific and multifaceted problems. And I think that it requires a lot of different perspectives to really treat them efficiently. But thank you so much. And that is the end of my presentation. Do you guys have any questions?
Thanks, Henry. First of all, I just want